Hi, I'm Libby Ling. I am the manager of the 5th floor Progressive Care Unit, and today I'm going to be making a presentation regarding a budget-neutral department improvement. And my department improvement is regarding implementing bedside shift report to improve quality. Quality care and new challenges. As we all know, historical fee-for-service models are being replaced by value-based reimbursement. Improving patient outcomes, satisfaction scores, collecting and analyze all this information has become quite important to maintain the success of this organization and to ensure reimbursement is adequate. It's all of our responsibility, not only the administrators, but all the employees, to work toward this goal of responsible quality care. Value-based reimbursement, I think most of us know what that is, but I will let you know. In the past, payers reimbursed providers based on the volume of patients. And of course, the new value-based reimbursement is the practice of reimbursement for quality outcomes. We're penalized for poor outcomes, the presence of never events, hospital-acquired conditions, and we're penalized for poor outcomes. And basically, value-based payment will be higher for us with a superior level of performance. Goals and benefits of value-based care. Benefits of value-based care, you might say, what are those? Because a lot of us kind of view value-based care in a negative light. But the goals and benefits for the patients are they will experience higher quality care at a lower cost. The payer will not be responsible to fully reimburse us for poor quality care and poor outcomes for the patient. Us as the healthcare provider, value-based reimbursement will prepare us for the future, including taking care of an aging population and help us to identify ways to improve costs and efficiency. And as you all know, we're taking care of sicker and sicker patients, and this will help prepare us for that. HCAHPS. For anyone who's not familiar with HCAHPS, it's a data collection and survey tool created by Medicare's, the CMS, to capture the patient's opinion of their actual experience in the hospital. So it's just like a survey. This information is used to compare hospitals and facilities in our own city and across the nation. So people can actually look up this data and compare us to everyone else. And it's used to improve quality of care and to make providers accountable for poor performance and for their outcomes. The quality improvement project I'm proposing is the training and utilization of bedside shift reporting by my nursing staff. A multitude of articles and research studies have been conducted on the impact of bedside shift report, and it affects quality measures and patient and nurse satisfaction in a positive light. The project is cost effective and budget neutral, yet it should impact the hospital's reimbursement in my department and improve patient outcomes. Bedside shift report, what is it? Bedside shift report involves the nurses from the day and night shift delivering a report to each other at the patient's bedside in a systematic way. There are certain criteria that must be delivered during the report in order for it to be successful. The patient should be involved and or their family if they request. The patient's condition and lines should be viewed, and any other pertinent information such as drains, wound locations, or any other critical items. What tools are needed to implement bedside shift report? The Agency for Healthcare Research and Quality recommends bedside shift report. They've created a detailed handbook on how to get started. That's very helpful. The handbook includes rationale and evidence for why bedside report improves quality and outcomes. It includes everything from how to teach nurses to why this tool is important. The SWOT analysis. The SWOT structure is a method of planning to determine the weaknesses and strengths we will face in the implementation of this project. So strengths, weaknesses, opportunities, and threats will follow. The strengths or benefits of bedside rounding include a low-cost way to improve quality. It gives patients more involvement in their care. It's a more complete reporting method, and the nurses will be more free of interruptions from, say, the telephone or people coming up to the desk. When patients are involved, there's less confusion about their diagnosis and treatment plan. It's been proven to decrease adverse events such as IV drip rates and falls. Patient satisfaction scores and nursing satisfaction scores have been proven to increase after the implementation of bedside rounding. The weaknesses, there is a small cost involved, although it's minimal. The nursing staff may criticize the program and form an opinion before it's even implemented or explained to them. And it's not a complete solution to improve patient satisfaction and HCAHPS scores. Opportunities and other benefits: it saves time. It creates cohesion and less chaos during shift change. And it's been shown to improve the relationship and mutual respect between day and night staff. Threats, risks, or negative effects of bedside shift report. There is a question of patient confidentiality, and there are some things nurses need to tell each other about the patient, not in their presence. Nurses may also fear that they will not be able to finish their shift on time if they go in to give a report and the patient asks for something. That's always a fear of nursing staff. And there may be pushback from the staff just because it's one more new thing that they must learn, along with all the others. Cost of the project: education will be needed for the nursing staff. And I've outlined all the costs here. That includes meetings to explain that to the staff at the cost of $750. Paperwork, handouts, paper, ink, laminated cards. And the first month cost, including startup, that I've calculated is around $875. So the whole project, less than $1,000. And to follow are my references as to evidence-based on why this has been effective. I hope you all will find this a good solution to increasing our quality measures. Thank you.